We all have our unique ways of thinking, feeling, and behaving. It's what makes us who we are. But sometimes these patterns can become so rigid and unhealthy that they interfere with our daily lives, relationships, and overall well-being. That's what we call a personality disorder. Imagine a pair of glasses that distorts how you see the world and interact with people. That's what it's like to live with a personality disorder. It's not just a bad day or a phase. It's a deeply ingrained pattern of thoughts and behaviors that can cause significant distress and impairment. These disorders typically emerge during adolescence or early adulthood and can persist for many years if left untreated. But there's hope. With proper understanding, support, and treatment, individuals with personality disorders can learn to manage their symptoms and live fulfilling lives. It's important to remember that personality disorders are not a sign of weakness or a character flaw. They are complex mental health conditions that require professional help and compassion, not judgment. Personality disorders are broadly categorized into three main clusters based on shared characteristics. Cluster A includes paranoid, schizoid, and schizotypal personality disorders, often characterized by odd or eccentric behaviors. Cluster B encompasses antisocial, borderline, histrionic, and narcissistic personality disorders, typically marked by dramatic, emotional, or erratic behaviors. Think of individuals who might have intense mood swings, difficulty controlling their impulses, or seek excessive attention. Lastly, Cluster C comprises avoidant, dependent, and obsessive-compulsive personality disorders. These are often characterized by anxious and fearful behaviors. Picture someone who constantly worries about social situations, seeks reassurance from others, or strives for perfection to an unhealthy degree. While these clusters provide a framework, it's crucial to remember that each personality disorder is unique, and individuals may experience a combination of symptoms from different clusters. Recognizing the signs of a personality disorder can be challenging, as they often overlap with other mental health conditions. However, some common red flags include persistent patterns of difficulty forming and maintaining healthy relationships, extreme sensitivity to criticism or rejection, unstable moods and intense emotional outbursts, impulsive and risky behaviors, distorted self-image and a need for admiration, fear of abandonment and frantic efforts to avoid it. For example, someone with borderline personality disorder might experience intense fear of abandonment, leading to desperate attempts to cling on to relationships, even if they are unhealthy. On the other hand, an individual with narcissistic personality disorder might have an inflated sense of self-importance and a constant need for admiration from others. It's important to note that these are just a few examples, and the specific symptoms and their severity can vary greatly from person to person. Section 4. Seeking help, diagnosis, and treatment options. Diagnosing a personality disorder involves a comprehensive evaluation by a mental health professional, typically a psychiatrist or psychologist. This process usually includes a clinical interview, psychological testing, and a review of the individual's medical and psychiatric history. Treatment for personality disorders often involves a combination of psychotherapy, also known as talk therapy, and medication. Psychotherapy helps individuals understand their thought patterns, develop healthier coping mechanisms, and improve their interpersonal skills. Medications, such as antidepressants or mood stabilizers, may be prescribed to address co-occurring mental health conditions like depression or anxiety. However, it's important to remember that medication alone cannot cure a personality disorder. It can only manage specific symptoms. The road to recovery can be challenging, but with the right support and treatment, individuals with personality disorders can make significant progress in managing their symptoms and living fulfilling lives. Section 5. Living with personality disorders, coping mechanisms and support. Living with a personality disorder can be incredibly challenging, both for the individual and their loved ones. However, there are strategies and support systems that can make a significant difference in navigating the ups and downs. Developing healthy coping mechanisms is crucial for managing the intense emotions and challenging behaviors associated with personality disorders. This might include techniques like mindfulness, deep breathing exercises, journaling, or engaging in hobbies and activities that bring joy and relaxation. Building a strong support network is equally important. This might involve confiding in trusted family members or friends, joining support groups, or seeking guidance from therapists or counselors. Remember, you don't have to go through this alone. It's essential for loved ones to educate themselves about personality disorders and practice patience, understanding, and empathy. Setting healthy boundaries is crucial for both parties' well-being. Section 6. Breaking down stigma, fostering understanding and empathy. Stigma surrounding mental health, particularly personality disorders, remains a significant barrier to seeking help and receiving the necessary support. This stigma often stems from misconceptions, fear, and a lack of understanding. It's crucial to remember that individuals with personality disorders are not defined by their diagnosis. They are mothers, fathers, sisters, brothers, friends, and colleagues who deserve our compassion and support, not judgment. By educating ourselves and others, challenging stereotypes, and advocating for increased awareness and access to mental health services, we can contribute to breaking down stigma and creating a more inclusive and supportive society. Section 7. Conclusion: a path towards healing and well-being. Understanding personality disorders is the first step towards seeking help, fostering empathy, and breaking down stigma. These complex mental health conditions can significantly impact an individual's life, but with the right support, treatment, and coping mechanisms, individuals can learn to manage their symptoms and live fulfilling lives. If you or someone you know is struggling with a personality disorder, remember that you are not alone. Reach out to a mental health professional, confide in a trusted friend or family member, and seek support groups or online resources. There is hope, and recovery is possible.